Good afternoon, everyone. I am Steven Baldoza, and for today, we are going to have an integumentary assessment. So, it is a skin assessment. So, I have here Mr. Don Humoas Jr., my patient. He is 19 years old, and I will be assessing his skin. So the skin assessment, sir, we will going to check your how healthy your skin is, or are there any complications or sort of like that. Okay na ba nimo, sir?
Yeah.
So let us start with the head. So first, we are going to see his hair, if it's okay. So we are going to check if his hair have lice or like any part of a family member of a lice. Check if there are any alopecias, like alopecias are like some part of your head without hair. So I think the patient is quite good. So and then his hair also is silky and smooth. So we are it is a healthy condition for a patient. And then let us start palpating if are there any lumps or nodules or cysts in his head. So I think there are no lumps or nodules. So I think the patient is quite good. So we are done at his head or hair assessment. And then we will check his skin color, if his skin is fair or are there any patches. There in a vitiligo, his neck, so it's quite good. And then this one, it's okay. So we should also check if there are any bruises or any cyanosis or sort of like that, because sometimes when you do skin assessment you must check, because sometimes some people are having physical abuse or from they are raped by someone, so we have to check that. We have some acne and pimples over his face, so I think it's quite normal because our patient is having hormonal changes because of his puberty. So we have some pimples, we have some blackheads, and also some other type of signs for puberty. And we're also going to check his eyebrow if it's good. So I think it's good. And so if the patient also has a beard, especially those people coming from the westerns, we also have to check the beard. So since our patient has a clear part of his chin, so it's okay. And so we should also check the texture and the moisture of the skin of the patient. So I think it is quite good. So we must also check his skin turgor, if he is hydrated or dehydrated. So by checking it, we must pinch some of his back of his palm and then release it. So as you can see, the patient is hydrated because while I released his skin came back right away. So we are done at the anterior part of the body. We're now going to the posterior or the lower extremities of the body. So as you can see, according to the history or the medical history of the patient, he was suffering from skin asthma or atopic dermatitis, eczema. So it is red, it is swelling, and it is itchy sometimes. That's why it creates scars. So but since our patient is having a good hygiene and do a lot of skincare routine, so his skin eczema has gone already, and now only the scars has been produced. So skin asthma or skin eczema is like a hereditary that causes itching and swelling because some hormones in your skin cannot produce the abundance of that will fight for the problems or some bacteria and viruses coming from the environment. So, so and also we are going to check his nails or his hands. So we have to check if are there any cyanosis, blockage or blood, bruises, um, like deformities, asymmetries, or sort of like that. And does his nails are having a good hygiene? So since our patient quite um, is quite a good hygienic person, so I think we have no problem to that, and his nails also are not um, having clubbing, so it's good. So we also have to check his back side of his body. So as you can see, there are, just like what I've mentioned before, our patient was suffering from skin asthma before. So it is possible that he has scars right here, there, and then there are still no lesions. So I think the patient is quite good now.